Hi, my name is Lori. I am a registered dietitian, and we are going to go ahead and talk about diabetes today. So we'll go ahead and get into it. So what is diabetes? It's a chronic health condition that affects how your body turns food into energy. It is long-lasting. It really does not go away. It's characterized as a group of diseases that are indicative of too much sugar in the bloodstream, also known as glucose. So what happens is your body breaks down your food into sugar, and then it releases it into your bloodstream. So when those sugar levels increase, it signals to your pancreas, hey, we're going to release this hormone called insulin, which then allows your body to use it for energy as the primary fuel source. Diabetes doesn't allow your body to make enough or to use it well. So too much glucose can stay in your bloodstream when there isn't enough insulin, or your body stops responding to insulin, which over time can lead to some serious health issues. There's also different types of diabetes, which we'll go into each one in detail. But this includes more well-known types as type 1 and type 2, but we're also going to talk about prediabetes and gestational diabetes. So we'll go ahead and go over type 1. It's caused by an autoimmune reaction, which means the body attacks itself, which tells your body to stop making insulin. About 5 to 10% of the population of diabetes have type 1, and it's usually diagnosed earlier in children, teens, and young adults. People with type 1 diabetes need to take insulin to survive, but it can still be managed with diet and exercise. Unfortunately, there are no preventative measures for type 1. This is lifelong. That's why it's diagnosed also so young. It's usually just managed with insulin. So alternatively, type 2, it really just is characterized by the body not using insulin well and trying to keep those blood sugars normal. 90 to 95% of people who are diagnosed with diabetes have type 2, so this is the majority. It develops over multiple years, so it's usually diagnosed later in adults. However, it's now being diagnosed more in children, teens, and young adults, similar to type 1. The symptoms may not be obvious to start, so it's very important if someone's at risk that they get their blood sugar tested regularly and go to doctor's visits for any kind of preventative measures. It can be prevented or delayed with healthy lifestyle changes, especially if some people are more at risk than others. So we'll go ahead and talk about prediabetes. Almost always people have prediabetes before being diagnosed with diabetes. You will usually have some sort of warning signs. 96 million US adults and more than 1 in 3 have prediabetes. And 8 out of 10 adults don't even know that they have it. With prediabetes, blood sugar levels are high, but they're not high enough to be diagnosed with type 2 diabetes, and we'll go into a little bit of what that kind of diagnostic looks like. So there's no clear symptoms, so testing and preventative steps are crucial, especially if you're at risk. It also increases the risk for developing type 2 and further increases risk for heart disease and stroke. But you can hopefully help reverse that. So we'll talk about gestational diabetes. This is a type of diabetes that affects pregnant women who have never had it and who have never had gestational diabetes. There's higher risks for the health issues for the fetus and for the baby. It typically goes away after the baby is born. However, it does increase the mom's risk for developing type 2 later. The baby then also has increased risk of developing obesity as a child or a teen and potentially develop type 2 diabetes later in life. And this is also why screening is very crucial in any kind of prenatal care. So there are various symptoms to look out for, especially when someone hasn't been diagnosed with diabetes. It can make it more difficult for wounds to heal, so they heal more slowly. This can lead to infection and other issues. And this is because it prevents nutrients and oxygen from energizing those cells, and it also decreases that immune function and increases inflammation. Thirst is also a symptom, constantly thirsty, which also makes people go to the bathroom more frequently. So, because your kidneys are working harder, they're trying to filter and absorb that glucose as much as possible and trying to get it out of the system. That's why you also people might also have sweet breath. That's also another symptom. High blood sugar goes without saying, but making sure that someone has access to preventative care and making sure that they're able to test blood sugar is very crucial. And extreme fatigue. This can be due to the high or fluctuating blood sugar levels or any other complications that someone may be undergoing when being diagnosed with diabetes. So now we're going to talk about diagnosis and kind of go over how diabetes is diagnosed. So first is an A1C test. This tells you how well blood sugars are managed in the bloodstream and lets you know the average glucose level over the past 3 months. It's commonly used to diagnose both prediabetes and diabetes, so it gives you a really good look of how it's managed. So with diabetes, that's anything 6.5% or above. Pre-diabetes, it's 5.7 to 6.4, and normal is anything below 5.7. I will say that at least at Children's Hospital where I work, a lot of kids that come in the outpatient setting, the doctors will refer them with about an A1C of 5.7 to see if anything preventative can be done, looking at diet and lifestyle, and seeing if there's any barriers before, catching it before it can get worse. And usually the kids that do come in, their family members or parents have been diagnosed with diabetes. So making sure that preventative care is key. And then second, it's a fasting glucose test. So this looks at your sugar levels at one point in time after you don't eat for 8 to 10 hours. So you'll get your blood work done usually in the morning, since you haven't hopefully eaten overnight, and see where your blood sugar levels are. So diabetes would be diagnosed at 126, prediabetes at 100 to 125, and normal is 99 or below. And then last but not least, a little bit more of an intense test. It's a glucose tolerance test. So basically what happens is it's measuring your response to sugar. You drink this super sugary drink and you get your blood levels checked at 1, 2, and maybe 3 hours after. Usually it's 1 and 2. But what it's measuring is it's trying to see the reaction of how your sugar is moving from the blood and into muscle and fat. So basically what the response is. And so with diabetes, that's anything 200 and above. Pre-diabetes is 140 to 199, and then normal is 140 or below. So let's look at the effects of diabetes. These can be acute or long-term. Acute ones, right, they happen every so often. Be hypoglycemia. So this is low blood sugar. This is the opposite of hyperglycemia, which is high blood sugar. And this is measured at 70 milligrams per deciliter or below. And something needs to happen to bring those levels back up, right? Usually it's maybe drinking a little bit of juice, a little bit of soda, having some candy on hand, and it can be dangerous. Each person reaction is different. It can include different symptoms such as shakiness, nervousness, anxiousness, sweating, chills, irritability, hunger, nausea, confusion, coordination, blurred vision, and sometimes when it's really bad, it can also you can also have seizures. So this can be life-threatening. It could have a lot of complications, so it's very important to make sure that those sugar levels are managed. Diabetic ketoacidosis is also another acute effect. It happens when the body doesn't have enough insulin to compensate to allow the blood sugar into your cells, so it just accumulates, breaking down that fat for any kind of fuel it can possibly get. This produces acids called ketones, and so when too many of these ketones are produced too quickly, it can build up in dangerous levels and can also be life-threatening. We have a lot of kids that come through the pediatric ICU with diabetic ketoacidosis, and sometimes that is their first diagnostic. They come into the emergency room and they didn't even know they had diabetes. So it can be pretty scary. And then there's different long-term effects. They can affect different parts of the body, right? As you can see in this person that's on the screen. So, starting from the head down, looking at eyes, this can look like retinopathy. This affects the blood vessels in the retina. It can be picked up from an eye screening test. Again, preventative care. That's where this comes in. Also the heart. So when you have diabetes, high blood sugar over a long period of time can damage those blood vessels. It can lead to cardiovascular disease, heart attack, or even stroke. And then going down to the kidney, we kind of talked about, right, how this filters, how this works. So high blood sugar and high blood pressure can cause damage to the kidneys after a long period of time, making it harder to get rid of those extra fluids and waste from your body, which can further lead to kidney disease. Your kidney is just working over and over and over time. And then going back to nerve damage. So this can involve neuropathy, and this is when blood sugars remain too high, which makes it harder for nerves to carry those messages from the brain to the body, which affects how people see, hear, feel, and move. And then down to the feet. So nerve damage can also affect feelings in your feet. High blood sugar levels can damage that circulation, making it harder for sores and cuts to heal, right? Talking about wound healing from earlier. These issues are super serious and can lead to amputation if left untreated. So we'll go ahead and talk about the prevalence. So over 37 million adults have diabetes, and 1 out of 5 don't know they have it. It is the 7th leading cause of death in the United States. It's also the #1 cause of kidney failure, lower limb amputations, and adult blindness. In the last 20 years, diagnoses has more than doubled. And then in Louisiana, looking at Louisiana, the state, 14.2% of adult Louisianans have diabetes, and 1/8 of them have been diagnosed with it. We are 4th in diabetes mortality rates after West Virginia, Mississippi, and Arkansas. So a lot of states in the South do have some higher prevalence rates of diabetes. So how do we prevent and treat and manage this? So prevention can include aspects like managing a healthy weight, which may look different for everyone. Maintaining a good diet, including a variety of different foods, and working with a dietitian can help with this as well. Getting exercise and engaging in some sort of movement that doesn't feel like a chore for at least 30 minutes daily also can help in preventing diabetes. And then treatment, it can also look different depending on how far along the diabetes diagnosis is and what type you have. So people with type 1 diabetes, right, have to utilize insulin as their body doesn't make enough. So regardless, they're going to have to get insulin from somewhere. Whereas people with type 2 diabetes may use medicine like metformin, which helps lower those blood sugar levels. And then overall management, making sure insulin is being dosed correctly, taking the medicine daily, checking blood sugar levels, and making sure to go to regular doctor's visits or having that access to do so. So now we'll go ahead and look at some social determinants and how that looks as the aspect as far as diabetes. So socioeconomic status, that's a big one. So this can involve things like income, education, and occupation. So looking at income, data from the National Health Interview Survey found that increasing diabetes prevalence in individuals with lower levels of income and significantly higher in areas that had lower incomes, lower high school graduation rates, more single-parent households, and crowded housing. And medical expenses for people with diabetes are 2/3 times higher compared to those who don't. So this makes it a huge issue as far as being able to access preventative services, care, insulin, the list goes on. So education. Diabetes incidence and diabetes-related mortality is highest for adults with less than a high school education. It was found that also higher levels of health literacy were significantly associated with lower hemoglobin A1C levels, right? That was the testing, the diagnostic testing we talked about earlier. Better diabetes knowledge, however, not with more frequent self-management activities. So that tells us that having, right, higher education will hopefully help with management of those levels. And so again, this is another social determinant that can't necessarily be prevented. And then occupation. This goes hand in hand with income as well. There's been an association found with high job insecurity and higher risk of incidence of diabetes, right? Looking at shift work. It has been found to be associated with a higher risk of diabetes compared to someone who's working a normal 9 to 5. The occupation level has found to be the highest prevalence of diabetes was among transportation workers and the lowest among physicians, right? Giving you that same access, that access point and income. And so place and physical environment, this can look like stable housing, which is an indicator of economic stability. And stability can look like maybe living in your car, staying with relatives or friends, having trouble paying rent, evictions, living in other crowded conditions, etc. The most unstable of which is homelessness. And this makes it difficult to access preventative services or practice any kind of self-management, which leads to worse control, higher use of emergency departments, and an increased likelihood of any kind of complications. And then looking at the built environment within place and physical environment, this includes other physical parts of where people live, work, and play, like buildings, streets, and green spaces. It's been found that there's an association between built environment with obesity-related outcomes. Some results of the studies that looked at diabetes found significant associations of walkability and neighborhood activities with exercise and a lower risk of type 2 diabetes and better outcomes, right? So if we have an area where, say, kids can play, people can get outside, you feel safe walking outside, the likelihood of you exercising and working in that preventative or self-care management is going to better those health outcomes for people with diabetes. Environmental exposures, different toxic exposures like arsenic in private wells to things like pollution such as Cancer Alley in Louisiana, right in our home state. Marginalized communities are disproportionately exposed to these aspects, which have an association with diabetes. Factors contributing to these inequities include residential segregation, inequity in goods and services due in part to the systemic racism in environmental regulation, which that can go on a huge different tangent. But these areas have poor enforcement of regulations. For instance, in a Native American community, there was unregulated wells, which are a source of water, which have contaminants, including arsenic, metals, pesticides, and other hazardous chemicals. This increased risk of diabetes in these populations lead to increased risk for any kind of disease complications. So not only do you have an increased risk of the chronic disease, but you also have these other environmental issues that are going on. And then food environment. This is something near and dear to my heart. So this can include how close someone lives in a store location, where these stores are, what kind of food services they have, and a place where the food can be bought. So there's been associations found between food access, availability, and diabetes, as the higher access to food was associated with lower type 2 diabetes rates. Higher availability of these full-service grocery stores and lower availability of fast food and convenience stores were also associated with lower diabetes rates. So this goes in hand with the food affordability and food insecurity. And then last but not least, healthcare. This is kind of the theme of what I've kind of been saying throughout this whole presentation. Access to health insurance is the strongest predictor of whether or not people with diabetes have access to diabetes screenings and care. This being said, uninsured adults have a higher chance of having undiagnosed diabetes compared to those with insurance. They will have fewer office visits, prescribe less medications, and have over 1.5 times more emergency room visits. So again, having access to preventative care is key. So to end, we'll go ahead and dispel a couple of myths. One of them is diabetes isn't that serious. That is absolutely false. It causes more deaths per year than breast cancer and AIDS combined. It also doubles the chance of someone having a heart attack. So it is very serious. This is a life-threatening disease. It can come with complications. So it is very serious and should be taken as such. If you're overweight, you will develop diabetes. That is not the case. So being overweight, yes, is a risk factor, but better risk factors are how much physical activity you get, your family history, ethnicity, and age play a role in all of this. Many people think that weight is the only risk factor, but there are many people with type 2 diabetes that have a normal weight or only moderately overweight. So again, you look at the whole person. And then my favorite one, people with diabetes need to stop eating carbs. So this is absolutely not true. A lot of people, right, looking at the keto diet or different diets that take or severely reduce the amount of carbs. However, that's our primary fuel source. We should not be getting rid of carbs. Our brains, our bodies, our muscles, they love carbs. And there's no scientific evidence that suggests people with diabetes need to avoid carbs. Evidence actually suggests that including appropriate amounts of carbs, protein, and fat in meals can help manage those glucose levels and not taking them out. We love bread. We love carbs. Our body loves it. Don't take them out. And these are my references, guys. Thank you so much for listening. Hopefully, we learned a little bit of an introduction to diabetes. So let me know if y'all have any questions, and have a great discussion.